I've just got a question like, can children, including infants, actually contract COVID-19? Thank you, Katie.
Yeah, so absolutely. Any age group can contract COVID-19. And in fact, we know that the rates, for example, in Australia among children were extremely high. So a couple of sero surveys have been done throughout the pandemic. And what they showed was very high rates. And the highest rates were actually in the teenage age group. So back a couple of years ago, we had about 70% of our teenagers already showed serological evidence of past infection. So these would be children that have antibodies to the nucleocapsid antigen. So that's not in the vaccine. And so that would tell us that they've been infected in the past. And in fact, quite a lot of them also had spike antibodies as well that hadn't been vaccinated. So that would again be consistent with them having acquired the infection. But even the 1 to 4-year-olds, around 61% of them at that time have been infected. So we now know that in Australia, most children will have acquired COVID-19. But what we do know is that their disease is a lot less severe. And really the biggest single risk factor for severe COVID-19 is age, and that increases exponentially when you sort of go over 75, 80 years of age, and that sort of age group very, very susceptible to severe outcomes. But younger children really not so susceptible to severe outcomes. And in fact, it's certainly, I was going to say about long COVID, that they would not have it as commonly as an adult would. Yeah.
What are the current approved medications for COVID-19 and long COVID?
So in terms of COVID-19, there's a few medications that we're able to use when patients come in with that, and they're quite widely used at the moment. So we have antiviral medications that we can use. There's oral ones and there's intravenous. So the main oral medication that we offer patients who fit the criteria is something called Paxlovid, which is an oral protease inhibitor. I'm not going to tell you the long name of it, but that's very well used. The only problem with that is that it has a lot of drug interaction. So if people are on multiple medications, it may be that they're not eligible to receive that drug. Then there's another intravenous antiviral that we use called remdesivir, and that inhibits viral replication. And we have to admit patients to hospital for that one because it's via intravenous infusion, but you can do it as a day case if you need to. Patients who've got severe disease and requiring oxygenation, we sometimes offer them steroids such as dexamethasone. And then the very severe ones, there are options to have monoclonal antibodies or immune modulators. So an anti-spike monoclonal antibody would be something like sotrovimab, and immune modulatory agents can be used such as anti-IL-6 antibodies. So tocilizumab is another one that we use. So they're the severe cases that often end up on ICU. We might use those agents. What has happened, though, during the pandemic, of course, is that the virus has been mutating and some of the agents have stopped being effective. So some things that we used earlier on in the pandemic, we can't use at the moment. And that's always going to be a concern. And they can speed up recovery a little bit, decrease the risk of severe disease, but they're not perfect by any means. But they're certainly useful for older people and then people with risk factors such as immunocompromising conditions, and we would offer them to those kind of patients.